comes a point when it's actually murder,
Mm.
when the evidence is so overwhelming and the authorities, so-called, are fully aware of that privately, and yet they continue doing the same thing. It might have been okay initially to have been just swept along with the international hysteria, lack of due diligence, etc. But even the Pfizer clinical trial killed 1,200 people right from the get-go.
Mm.
That was public information. And any drug historically that kills 50 people in a clinical trial gets the kibosh. So the evidence is for murder is overwhelming. First of all, of course, it never was a pandemic. That word is used far too loosely. A pandemic is an international spread of a pathogen that kills a lot of people. Well, excuse me, knock knock, this one didn't. There was no excess mortality in the first year before the vax came out.
Mm.
And the hospitals were empty, with a singular exception of Britain and New York. Britain, where they were killing people by the thousands with remdesivir, and New York, where they were killing thousands with the ventilator abuse. So we're predicting a tsunami of dementia and heart failure over the next 10, 20 years
Right.
in a system that's already decomposing. The healthcare system in Britain and elsewhere is massively underfunded. And it will suddenly have to look after a lot of people with very demanding needs. Then you have turbo cancers that you might have heard about.
Yes, absolutely.
Turbo cancers are real. Um, they're not stopping. They are affecting younger people very aggressively, late presentations, resistant to treatment, etc., etc.